going to talk about the major manifestations of Jones criteria in rheumatic fever. For detailed and comprehensive description of each criteria, do like and subscribe our Rainbow International Healthcare YouTube channel. Five major manifestations of Jones criteria. These are carditis, polyarthritis, chorea, erythema marginatum, and subcutaneous nodules. This is almost always associated with a significant murmur. In an individual without previous rheumatic fever or rheumatic heart disease, a significant apical systolic murmur, apical mid-diastolic murmur, or basal diastolic murmur can be seen with carditis. Called cardiac enlargement in an individual without a previous history of rheumatic fever or an obvious increase in cardiac size in a patient with a past history of rheumatic heart disease can be present with cardiomegaly. This can be manifested by friction rupture, pericardial effusion, or definite electrocardiographic evidence. Congestive heart failure in a child or young adult in the absence of other discernible causes can lead to pericarditis in rheumatic fever. This is almost always migraine-free and is manifested by swelling, heat, redness, and tenderness, or by pain and limitation of motion of two or more joints. Arthralgia alone, without other involvement of joints, may occur in rheumatic fever, but it is not considered as a major manifestation in rheumatic fever. Involuntary, rapid movements often associated with muscle weakness are characteristics of chorea. This must be present and can be differentiated from others like tics, acidosis, and restlessness. Chorea is a late and delayed manifestation of rheumatic fever, and it's a very characteristic of rheumatic heart disease, which can be present and sometimes not. Marginatum is an evanescent pink rash characteristic of rheumatic fever. The erythematous areas often have a pale center and round or serpiginous margins. They vary in their size and occurs majorly over the trunk and proximal part of extremities, but never over the face. Is transient, migrates from place to place, and may be brought out by the application of heat. It is non-pruritic, not endurable, and blenches over pressure. Is transient, migrates from place to place, and may be brought out by the application of heat. It is non-pruritic, not endurable. Cutaneous nodules are formed, painless, and seen and felt over the extensor surface of certain joints like elbows, knees, and wrist, in the occipital region, or over the spinous process of thorax and lumbar vertebrae. The skin overlaying them moves freely and is not endurable. Cases of acute rheumatic fever should be made, therefore, with clearly expressed major clinical manifestations as explained by the Jones. The indication for long-term prophylaxis is convenient but in doubt. In the absence of curative agent, one should not suppress the signs and symptoms of rheumatic fever until they are clearly expressed and clearly diagnosed by the physician.